As a child life specialist, it is always my goal to continuously apply the ethical principles in my practice. These ethical principles are, of course, set forth by the Association of Child Life Professionals to help guide our decision making in our practice every single day when we work with hospitalized children and families. I, of course, want to always implement every single principle in my practice. And I think a lot of these principles go hand in hand, but one of the principles that stands out the most to me and that I want to continuously always apply in my practice is the principle of beneficence. Beneficence is, of course, the duty and obligation of child life specialists to always do good for children and their families. I think that as a specialist, we do this every day through our assessments and our interventions and just supporting children and families and trying to advocate for what's best for them. In my internship, I actually had practice putting this principle into live action. I worked with doctors, nurses, occupational therapists, speech therapists, and other team members to work and find what's best for children and their families in the hospital. I sat on weekly team meetings and worked with children and their families to find what their needs were. I think it was really important for me to collaborate with the team members, but also with the children and their families to find and advocate for their needs. As a specialist, it's always my goal to continuously support these kids and their families, and I think that by doing this, I'm implementing this principle of beneficence. I'm always advocating for what's best for them and what I think and what the patients and their families tell me is what's best for them. Even if I don't agree with it, I think just having this open mind of communication with the children and their families is something that is really important. Moving forward, I want to continuously apply this in my practice in the next couple months as I start my job as a child life specialist. I want to continuously apply this and do what I was doing in my internship and continuously carry it over into my actual career. I went to work with the nurses and the doctors at the bedside and with the patients and, trying to find what's best for them and what they feel are their needs and communicating that to the doctors and nurses and advocating for their needs. And then also working with the other interdisciplinary team members to find the best routes to take to support these kids and their families and, ultimately do what's best for them, which I think is the root of the principle of beneficence, and it's something that I feel strongly child life specialists everywhere should apply in their practice.